Happy Nat Cab to those who celebrate. Before today's meeting, the Doherty Institute gave state and federal leaders a big lump of coal, modelling that offered a worst-case scenario of more than 200,000 cases a day and around 4,000 hospitalisations every 24 hours by the end of January.
Hopefully their predictions about number of hospitalisations are not close, but if they are, they're extremely worrying.
But today, the PM threw the nightmare figures into the big metaphorical blast furnace marked hyperbole.
The modelling that's been reported as a very unlikely extreme case scenario that assumes that nobody does anything, nobody gets boosters, there are no changes that take place, no one exercises common sense.
Back in the present, New South Wales surged to another daily case record. Fortunately, hospital and ICU admissions only rose slightly. And as testing delays wreaked havoc on holiday plans, the Queensland Premier was copping it.
It is not a highly productive way to use a PCR testing system.
Because this testing is causing angst amongst the populations in New South Wales.
10%.
Over a quarter of all the tests we're processing for interstate travel purposes.
10% after. No, you've got this wrong.
I can't imagine how confused your viewers are right now.
After Nat Cab, the PM signalled a likely loosening of testing requirements for travellers.
And the medical expert panel will give further advice on whether testing is required at all for travel, or we can move to the more simple method of rat testing.
However, he continued to resist calls for an indoor mask mandate.
What matters is that people wear them, not whether people get fined or not.
And rather than reducing the wait time for boosters,
that will be a decision for the vaccination experts at ATAGI.
The focus was on boosting capacity.
We did see the demand at state-based clinics decline. They now need to be ramped up again.
In summary, be alert, not alarmed.
Australians have worked very hard to have this Christmas together, and we want to protect that.
Well, infectious diseases expert and former Deputy CMO Dr Nick Coatsworth is alert but not alarmed. Dr Nick, it's clear the PM's personal responsibility approach isn't controlling the spread. Why not just introduce indoor mask mandates?
Well, Hamish, I think it's important to take a step back and realise that this personal responsibility approach is not some new Trumpist libertarian thing. It's about having a balance between government intervention and what people need to do to be empowered to do to move forward and live with COVID-19. So I think that's the principle behind it. We know that National Cabinet met today. We know that indoor mask mandates were discussed, and they may well come into play in the coming days across the states and territories.
You can see why this is confusing to the Australian population, though. The whole way through this pandemic, our politicians have said, the health advice leads us. Those that have been leading us through this say something simple like mask mandates, shutting down those big events where lots of people congregate, are the right measures temporarily to stop Omicron from getting out of control.
And I think after National Cabinet today, where that was presented by Professor Kelly, you will see some of that coming into play. But let me put this to you, Hamish, that we're in such a different position. We have vaccines that work. We know that if you get a booster, your immunity's back up within a week to where it was before. This is now a very treatable virus. We just need to, as our public health professionals are suggesting, we need to manage the numbers.
But Nick, at the moment, we're just a couple of days away from Christmas. You've seen those numbers in New South Wales. They're going through the roof. People's Christmases are being destroyed because that's the state where there is no mask mandate. The Prime Minister keeps saying, let's look at this like the slip, slop, slap message. The problem with that, as your point of reference, is if you choose not to wear sunscreen, you're the only one that gets sunburnt. If you choose not to be COVID safe and not wear a mask indoors, which is what's happening in New South Wales right now, where the numbers are through the roof, then you are putting everybody in the vicinity at risk. Isn't it a no-brainer?
Well, let's unpack it a little bit, Lisa. I think that, independently of the analogy, what we want to do is help people make their own decisions, good decisions, about how to protect themselves and others. With regard to the numbers, though, it needn't be about case numbers now. It has to be about hospitalisations, Lisa, because if it's not, we've basically moved nowhere since 2020. And I do think we need to move forward, focus on hospitalisations and making sure our health system is robust and resilient, which so far it's turned out to be.
Well, I think you have to tell that to all the people whose Christmases in New South Wales particularly are being ruined. But anyway, let's move on. The latest Doherty modelling points to up to 200,000 cases a day by late January. Even if that's a worst case scenario, can you understand why so many people want stronger action taken in order to avoid that?
Well, I would, again, take a step back and refer to what Paul Kelly said today. That is an extraordinarily unlikely scenario, to the point that perhaps it should never have even entered into the model. When you leak numbers like that without context, it's very damaging to community opinion. And, you know, of course people are going to be afraid about that, but it's just not going to happen.
Now, Dr. Nick, we need to talk about you and the AMA. You're having a bit of a go at each other publicly. We all hope and expect that our trusted doctors are going to get along with each other. Are you going to kiss and make up, or whatever the COVID-safe equivalent of that is?
I think that'd be a wonderful thing for Omar and I to do here on the project. We should. But look, Susie, I do take a really strong view of how medical leaders should sort of present themselves with regard to COVID. And it is really hard to govern as a government or as a public servant, a bureaucrat, when you've got the AMA nipping at your heels and saying that the decisions that they don't agree with mean that you're putting lives at risk. Now, you know, at the end of the day, they don't have that many infectious disease physicians. So, you know, whereas we need to see where government's getting its advice from, I'd love to see the AMA tell us where they're getting their advice from as well.
Do you think maybe calling them a peanut gallery was a bit much?
Oh, look, I mean, I think when you have an organisation that comes out and says that the booster program is off track when it's only just been changed, you know, I think it demands some sort of response. People will judge whether that was too much or not.
All right, Dr. Nick Coatsworth, thank you very much.
Thank you.